Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
It's Lindsay Smith Rogers. Today, how investigating spillover events with a One Health approach is a vital part of pandemic prevention. I'm joined by two experts in spillover event investigation, Dr. Raina Plowright, a veterinarian and disease ecologist at Cornell, and Emily Gurley, an epidemiologist and distinguished professor of the practice at Johns Hopkins, who talk about what goes into these complex investigations and a new Coursera course for anyone interested in learning more. Let's listen. Emily Gurley and Raina Plowright, welcome to Public Health on Call. We're so glad to have you. Today, we are talking about pandemic prevention, specifically spillover events. Would you start off by giving us a refresher on what spillover events are and maybe some examples? Let's start with you, Raina.
Sure. So spillover is the transmission of a pathogen being like a virus or bacteria, between species. And we call it zoonotic spillover if the pathogen's going from a non-human animal to a human. We call it a zoonotic pathogen. That's the pathogen that actually does the spreading from animal to human. And then the disease that results from that is called a zoonotic disease. And almost every pandemic in the last 100 years has started with a spillover, a zoonotic spillover, but not all spillovers start pandemics. It's like sparks and forest fires. All fires start with a spark, but most sparks do not cause forest fires. So actually spillovers are happening everywhere, all the time. When we walk outside and we breathe the air, we're breathing in viruses and bacteria from birds, other animals, from trees, from the soil, and we rarely get sick. But when they do actually make us sick, they can be really serious. So another example of a spillover that's really common is rabies. Everyone's heard of rabies virus, and that happens when a rabid animal bites a human. And about 60,000 people die of rabies every year, mostly people in Asia and Africa. And this is a horrific disease to die from. Lyme disease is another example of a zoonosis. When a tick bites an infected animal and then that tick bites a human, we can get Lyme disease from that animal. And there are many, many examples of really common zoonoses, but most of them don't spread when they get into humans. So the human is actually like a dead-end host. But to have a pandemic, pandemics are almost always caused by viruses, so I'll use viruses as an example, but the virus has to be able to transmit really effectively from human to human, and that requires quite special abilities of a virus. So, for example, not only when the virus gets into our body, it has to get through our immune system, but it's got to get to the right place in our body where it can spread. For example, many avian influenza viruses haven't spread well amongst humans because they haven't been able to infect the upper respiratory tract. SARS-CoV-2 virus, by contrast, actually it infected the upper respiratory tract very well and was able to then be coughed into the air. It then survived in the air to be able to be spread to other humans. But not only does the virus have to be able to spread among humans, but those humans have to be sufficiently connected to be able to actually spread the virus around. So, for example, there have been outbreaks of Ebola in Central Africa for a long time, and they've always been quite contained. But when Ebola emerged in West Africa, in a very well-connected, dense city, it actually spread very well. It caused, in 2014, around 28,000 cases, 11,000 deaths in West Africa.
And so all of these sparks are happening all the time. And I want to we're specifically talking today about the One Health approach to looking at spillover events. And so how do we look at these investigations into these sparks, and what is the One Health approach? Emily?
Yeah, great to be back on Public Health on Call. Thanks for having us. So One Health is the idea that human disease is often connected to what's happening in our environment and what's happening in other species. So you could hear from Raina's example of what spillovers are, that they really would benefit from this One Health approach. Once a spillover infection is identified, you need to look beyond just the patient to try to understand what happened, including where the infection came from and how that spillover occurred. What happened? What were the chain of events? And that often involves what's happening in the environment and with other species. What other species were infected? What was the reservoir host? What were the specific exposures that led to that infection? And so if we think about spillovers from this One Health perspective, this holistic perspective of not just what happened in the person, but how did that infection come to be? And the best way to do this is through a multidisciplinary approach, where not only do you have epidemiologists investigating human cases and clinicians investigating the disease, but you would also involve laboratorians, microbiologists, you would involve anthropologists and social scientists, because they would bring a different perspective into thinking about the interactions that may have occurred, particularly from the perspective of the community. You would involve environmental scientists and ecologists, because you'd also want to understand what's happening more broadly in the environment and with other possible reservoir species or the animals that harbored that infection. So One Health approaches are really useful for many different kinds of outbreaks, not just zoonotic spillovers, but zoonotic spillovers are a special case where really that is the only way to understand how they occurred. And like Raina said, because those sparks sometimes lead to large forest fires, it's really in our best interest to understand how they happen. And that's what a One Health approach can give us.
Who might coordinate all of these different actors in a One Health approach?
Any kind of outbreak investigation is led typically by public health. And that's because once a human has been infected, there is a responsibility on behalf of public health and governments to take some action, to investigate. Public health authorities have laboratories, they have clinicians on the team, they may have veterinarians as well that could help with One Health investigations. They may not always have the social science expertise or the ecological environmental science expertise. And so often to accomplish a One Health investigation into spillovers, you need collaborations with academia or other partners. So that's really, I think, one of the reasons why they're more difficult to do. There are good reasons why they're not the standard always in every investigation, because they're harder. It's harder to bring more people together. But if we're able to overcome those barriers, we really have a lot to gain.
I do want to point out that on this call, we do have a veterinarian and an epidemiologist in this conversation. So we're starting the work here a little bit. So Emily dropped this thread. Raina, I'd like you to pick this up about why, once these events occur and you investigate them, this is actually a part of prevention. Can you tell us more about that?
Sure. So to prevent something, it's very helpful if you can understand how it actually happened. And I'll give you an example, actually, of our team's One Health spillover investigations, and then how that led to a really surprising outcome on how spillovers happen. So I work on a virus called Hendra virus, and it's transmitted from bats, big fruit bats that tend to eat nectar actually rather than fruit. And it's transmitted from bats to horses in Australia. And it has a very high fatality rate. About 80% of horses die. And then humans who are caring for sick horses can get the virus from the horses with about a 60% fatality rate. So it's a very serious disease. And we were investigating a particular outbreak where there'd been a spillover event on a horse property, and the horse had died, and the whole family had actually been potentially exposed to Hendra virus. And we were talking with the horse owner, and she was very distressed. It had been probably the most difficult time of her life, having lost her pet horse, but all being exposed to this deadly virus. And she described the circumstances leading to the spillover, where it had been raining really hard. Their horse had been in a paddock that had turned to mud, and she'd moved the horse into their lemon orchard. to get out of the mud. She also described at the time that a population of bats, these fruit bats, had just moved into a patch of bushland near her property, and that the bats had been coming in and actually eating the lemons in her orchard. And we knew as ecologists and veterinarians that bats don't eat lemons. Like, that is a food of last resort. Bats would only eat lemons if they were starving. And we'd actually been tracking those bats and found that they were shedding a lot of hendrovirus because they're in a food shortage, hence why they were eating the lemons. And that sort of investigation gives a lot of clues. So in previous investigations where we had ecologists go onto properties, we found also bats were exhibiting behaviors of starvation and eating these really strange foods that they wouldn't otherwise usually consume. So that led us then to start to look at long-term data and talk with community members. The first people we talked to were people who take bats into care when they're injured. And the bat carers said that around these times of spillovers, they were seeing a lot of bats come into care with starvation. We talked to beekeepers and found that the beekeepers during those same periods couldn't find places to put their hives. There was no nectar in the forests. And we looked over time and we saw these spikes that would happen periodically every few years where the bats were coming into care at the same time as the bees couldn't find nectar. And then we also were able to show that those spikes were preceded by high El Nino events. So these high temperatures in the Pacific Ocean that caused hot, dry conditions in Australia, and that was drying up the nectar on the trees, hence causing these shortages of nectar for bats and bees. And with a lot of investigation, it really was over 10 years of investigation, we eventually showed that the bats had been losing their winter habitat, and as a consequence had been moving into farmlands, hence those bats that the horse owner talked about that had just moved into the bushland near them. And then when they had these climate extremes, the bats were starving and then shedding virus, and then we'd see spillover events. What was actually really surprising from this study, though, is that from those events, we were able to make predictions, and we were able to predict most of the clusters of spillovers, but not all of them. And so we knew that we were missing something. And we went into year 2000, predicting a big cluster of hendrovirus spillovers based on El Nino, based on bats coming into care, based on the bees not having food. And then there were no spillovers. But we had a team on the ground investigating bats, and we found that actually most of the bat population had aggregated around what ended up being this big pulse of flowers blooming in a remnant patch of winter forest. And that then led us to retrospectively look over 25 years and find that every time winter forest flowered, which was becoming quite a rare event because it was almost all cleared, but every time that happened, there was never a spillover event. And that then gave us this whole other way of preventing spillover. So now we really have these two major tools. Well, the first things are things that we can do right on the ground where the spillover happens. So we can fence trees where horses graze, where bats feed. We can feed horses away from those trees, and we can vaccinate horses, which is really actually quite effective. But there are things we have to do all the time, everywhere, to reduce that risk. We can also, while we're doing those things, now start to replant that winter habitat that has led to bats moving into the farmland in the first place, and that we know when it flowers will draw bats away from the farmland and protect the landscape from spillover. And if we weren't on those properties investigating with a One Health approach, we wouldn't have learned those really important factors.
That is a great story. Right now, for people that want to learn more about this kind of thing, there is a new Coursera course. Emily, would you tell us a little bit about this?
Sure, I'd be happy to. I've been thinking about a training and course like this for about 15 years. So we really had the privilege of working with a One Health outbreak investigation team in Bangladesh for many years. We knew how special our unit was, where we had this approach that we applied to every outbreak where it made sense. We investigated zoonoses like anthrax, Nipah virus, avian influenza, and even non-infectious causes like pesticide poisoning that all really benefited from this One Health approach. So we put together a course that's designed for, anyone who works on outbreak investigation and anyone also who's interested in outbreak investigation or wants to know more about how they might fit in. And the course sets out the vision for what a One Health approach is. There are 7 different modules from the perspective of each of the disciplines, like the core disciplines that typically contribute. And as we've already mentioned, that's clinical medicine in humans and veterinary medicine, epidemiology, social science, environmental science, entomology, as well as ecology. So students will learn, what does that perspective bring to an outbreak investigation? And importantly, how do they work together? How do they bring evidence from each of their perspectives to really build out our knowledge of this causal chain of events that led to the spillover event? There's a lot of discussion now about how to prevent pandemics, and there's a lot of emphasis on vaccines, on responding quickly to outbreaks, which is great. But if we can work on getting further upstream, again, I think there's a lot of potential there. And there have been global conversations about spillovers and how to prevent them. Most of those conversations and most of the efforts have been at an administrative level, at a high level. How do we get governments to think about this? How do we get ministries to agree to work together? The course is designed to be the bottom-up support for those global frameworks and thinking so that we can actually train a workforce on how to do this and hopefully inspire them to try it out.
And we will include a link to that course in our show notes. Emily Gurley and Raina Plowright, thank you so much for being with us today.
Thanks, Lindsay.
Thank you.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Michael Bonfils, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production coordination by Katharine Ricardo. Analytics by Elisa Rosen. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.